Good morning, everyone. Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce, and we're glad you could join us today for Coffee and Conversation. This is a Zoom meeting, so if you have questions of the speaker, I'm sure that Shelby won't mind if you interrupt her and ask questions. If you're on Facebook Live, which is our larger audience, type your questions in, and Tiffany or Laura will get those questions answered for you. So this will also be recorded and put on our YouTube channel after. So if anybody wants to refer to it or share it with somebody, you can do that as well. So we are excited today to hear from Shelby Bettinger, and she's going to be talking about how to prepare for senior living. So something that either we're all going to face at some point, or we are dealing with parents or relatives or something right now. So I think it's a really great topic. And with that, let's do self-introductions.
Good morning, everyone. I'm Tiffany Grubb, Director of Marketing with the Greater Hamilton Chamber. I'm just going to go around my screen and introduce yourself and what company you're representing. So we'll start with Cindy.
Hi, everyone. Good morning and happy Thanksgiving week. I'm Cindy Keitel with Keitel Business Coaching.
Awesome. Gina?
Hey, guys. Yes, happy Thanksgiving week. I'm Gina with Land of Illusion. Hope you're all having a great day.
Great. Patrick?
Good morning, everybody. Patrick right here with ServPro doing property damage restoration.
Thank you. Jason?
Good morning, everyone. I'm Jason Michael Miller, Director of Membership and Engagement for the Greater Hamilton Chamber of Commerce, and it is lovely to see you all this morning.
Lovely to see you too, Jason. Laura?
Hello, everyone. I'm Laura Merrill with the Greater Hamilton Chamber.
Dan?
Okay, we ready to get started? Shelby, it's all yours.
All right. Good morning, everyone. I'm just going to share my screen really quick here. All right, and my computer is being extra slow today, so please bear with me. But I am Shelby. I work at Liberty Station Health Campus. We are one of the 5 Trilogy campuses down here in Cincinnati. I have worked with Trilogy for about 4.5 years, but I started my senior living in Texas at the Tradition. I worked for them for about 3 years, and then I moved back to the state of Ohio working for Communicare. So I've worked in a few different companies and a few different senior living styles. I did graduate from Xavier, so of course I had to throw that in there. But I am very happy to answer, as Dan said, any questions at any point, or if anything I said doesn't make sense, just let me know and we can start over. So what are some questions that, for those of you who have had any type of encounter with senior living, what do you think is the most important about senior living or things you should look for? So I'm going to make you all participate for the morning. Make sure.
I like that my fiance's mother is in Otterbein, and I like that where she's at, if she ever needs to be upgraded, she can be upgraded on that campus.
Love that. Very important. Yes. Anyone else?
Activity based upon their level of capability.
Yes.
I think a big question or concern I have is how clean is the facility?
Mm-hmm. Very good. Very important for infection control and everything else. Perfect. So I'm going to do a very, very high level, things you should know, things you should look for if you're planning ahead for yourself. If you're nearing that age, of which age does not mean anything, while being a senior is 55 plus. I don't know any seniors who are 55 or anyone who's 55 who considers themselves a senior. So just keep that in mind, that age is not a strong determiner of where you need to be in your life. But just some overview things for planning for yourself, planning for your loved ones, parents, whatever that may look like. So the first thing is insurances. So these are going to be the easiest to find because they're probably going to be in their wallet. So you'll know what coverage they have. Just because you have Medicare doesn't mean you have coverage for something like a rehab or coverage for something like your any of your prescriptions or doesn't mean you have coverage with your doctors. So make sure that when you're looking at your insurances, and we are in open enrollment period, that you do have the coverage that you think you have. So whether you're working with an insurance broker or something like that, make sure you do understand what you actually have, especially if you're over 65. Long-term care insurance can be super, super helpful for you if you do plan on needing long-term care, meaning assisted living or like a health center or skilled nursing. No other insurance is going to cover those. So Medicare will not cover those. Just as an FYI, Medicare only covers a short-term rehab stay after a hospital stay. Long-term care insurance works something like your life insurance. So you pay into it month after month, year after year. And in the end, it ends up, for some of our seniors that are, residents now, it's covering a lot of their bill. So it's a really good thing. They don't sell it like they used to because nothing ever does. But if you're asking your parents, do they have this? That could save them a lot of money because they've already paid into it. And the last thing is your funeral paid for? So you can have different types of insurance that will pay out, like your life insurance that will pay for your funeral. If it's not paid for and you don't have life insurance, we know you don't care because you won't be here to plan it, but your children are going to care. And whoever is taking care of your estate at the end is going to have to come up with that money somewhere. So plan ahead, whether that's having it paid for through your life insurance or through you just going to the funeral home and already paying for that as well. I know that can be very hard to talk about on a Tuesday morning, but it is something that you do need to think about, because I've seen a lot of families go through and they get to the end and they're like, well, how are we going to cover this? And if you didn't have a plan for it, they have to come up with a plan for it. Financially, this is always the hardest part to talk about in any senior living, because the generation that's looking at senior living right now, they didn't talk about money. They didn't talk about debt. They didn't talk about how much their house cost or how much their mortgage payment was on a month-to-month basis. It's not something they ever want to talk about. The rest of the generations, we kind of don't care as much. We'll tell you exactly how much it costs our house to buy and how much debt we have because it's less important to us. So having those conversations before you have to have the conversation, it makes it a whole lot easier because then you can have it over a cup of coffee instead of in a less fortunate situation. Now, when you're looking at all of it does matter. So all of the houses that they owned on every lake and every ocean, those all factor into it. All of their classic cars that they've collected over the years, that all is going to count into it. Every possible 401k that they had for every job, it is still sitting there if they didn't transfer it over into something bigger. Looking for these things can be really complicated if you don't know all of mom's history. If you only know the last 40 years, because that's all the older that you are, it's going to be really hard for you to try to dig up all of these things when she can no longer tell you where they're at. So having these conversations earlier and for you yourself, I know I just showed you, I've had multiple jobs. So I have multiple 401ks that have to be dealt with or taken care of to be able to have access to them. And when you're talking about senior living, having access to your assets is very, very important because you will need it on a monthly basis to be able to pay for your lifestyle. Any questions on that? I know I tend to talk really quickly.
I was just going to affirm, Shelby, I love how you are breaking everything down into digestible chunks for anyone at different levels of understanding this.
Oh, thank you.
Yeah.
Yeah, I thought that might be easiest because I know we were going to have a wide variety of people on here. So definitely, yeah, having all these questions and not all at once. I do not suggest, sitting down on Thanksgiving dinner and being like, so mom, let's talk about this. Maybe not the best time, but it is good to talk about all of it. So then after you have the hard stuff out of the way, you can focus on what's important to you. So now that you know where you stand financially and you know where you stand with your insurance on what you're going to have to pick up as far as co-payments and things like that, what's important to you? Does mom have her cat that she's had for 10 years and she wants to bring that with her? You can't bring those to all of the places. Is like Gina said, are you excited to only have to make this decision once? And so you need to choose a place that is going to be good forever for them, or good for the most of the time for them? Or are you okay with going to just an independent living for now? And when the needs change, you make another decision because you want to choose what's best for them in that moment. There is no right answer for everyone, but there is a different right answer for everyone. And there are lots of different options to be able to meet those needs for everyone in the moment that they're needing them. Location is huge. I can tell you, the closer your loved one is to you, the more you're going to visit them. But if they really just want to be on a beach in Florida, maybe not Liberty Station, because I unfortunately don't have a beach in any of our courtyards. So just seeing what is the most important to them. It might be that they want to go to every single Xavier basketball game that they can, and they want to have a place that is going to provide transportation to them for every single one of those events. What's important to each person is different. And as we age and as we go through different life stages, what's important will change. So keeping all of that in mind as well. And then what type of style living do you want to have? Do you want to have everything under one roof? Would you rather still have your own space in a villa or condo style? Do you want to be in an apartment? Or are you okay with something a little bit smaller so that you have access to more amenities? All of those things are things to take into consideration, especially in this greater Hamilton Cincinnati market. There are a lot of different options and a lot of different things to look at. But depending on what's important to you, you can cross half of them off your list, just for whichever point is most important to you. So great questions to ask as you're going through. So you've made the decisions, you already know kind of where you're headed, you've picked out your locations. When you're there, you need to ask them, is there a wait list? So it is the time of year where things start filling up. It's just how it goes. Around the holidays, people start seeing that their loved ones might not be doing as well as they thought they were. And so things start changing, and they change very quickly. Is there an entrance fee? So just because we told you that, the monthly rate is XYZ, doesn't mean that that's what you owe me before you move in. So make sure you check that out. Ask them what happens when or if you run out of money. If your funds are limited, you need to be asking this question so you don't have to scramble when, the bucket runs out on where you're going next. Do you use agency staffing? So through the joyful years of COVID, agency staffing has been something that about 60 to 70% of all senior livings now use. So asking that, do they use the same staffing? Do they use no staffing at all, so that everyone that is there is their own employee, and they're going to know your mom a little bit better than someone who's only been here for, 1 or 2 days and then jumps to the next place? What's all included? So again, just because we quoted you a daily or a monthly rate might not mean that that is your final rate. There may be level of care costs. There might be a la carte expenses like different medications, administrations. Are your meals included? Is laundry included? All of those things are things to consider. So while we all give you one starting rate, what is your final, bottom line month after month? What's that going to look like? So that you can financially plan how far down the road you have. Are there different levels of care? Those will factor into whether you can move just down the hallway to continue to be cared for, or are you able to stay in that exact apartment until as all of your needs change. Asked to see an activity calendar. So while we are all required by the state of Ohio to conduct activities, if they're not scheduled or they can't give you an activity calendar, and activities and being busy is something that's important to your loved one, that might not be the best location for you. Do they have social media? So you can check out and see what they're actually doing on a day-to-day basis. But please also know, as a marketing person, we do only post the best photos. And if you're seeing the photos that don't look great, know that those were the best ones they could come up with. So keep that in mind. And I say that from, graduating with a marketing degree and working in sales. Please know that they're only using the best photos, and you should take that into consideration for the good and the bad. How's the food? If they're not showing you pictures of the food, they didn't invite you to join them for a meal or an activity that included food, their food might not be great, and that's why they're not showing it off. I have our chef here in a picture, so we grill out all summer long, at least once a week for our residents. We do a whole lot of different things with our food, and we've invited you all to try ours out. So if you haven't stopped by to test out our food, we would love to talk about that. So tips, when you're filing for Medicaid, please, please, please use an attorney. I cannot stress enough, they know all the ins and outs. You don't. I don't. And I've worked in this for years because Medicaid changes every year, and what it takes to be approved. If you're using someone who knows all the tips and tricks, they can get you a whole lot faster. I've seen some families wait a year or more to get approved for Medicaid, which could cause you to be asked to leave the place that you're living at because you're technically not paying your bill. And if you don't have all the right paperwork the first time, Medicaid will continue to delay everything for you. So please use someone who can help you get that approved a little bit faster. It will be less headaches for you, I promise, and less headaches for your loved one. Take a tour. Take 2 tours. Make sure everyone who is involved in your decision-making process. So if there are 8 children that are helping to make this decision for mom, let all 8 tour. They can do virtual tours. A lot of them will let you FaceTime while you're touring. Have mom see it. And then try, like I said, try the food. Food is important. It's one of the biggest complaints industry-wide about senior living is the food. So please, please, please make sure you're trying it to make sure you know what you're getting into, because they will be eating it 3 meals every day, 7 days a week. And then tour a couple places. So while you might come tour with me and absolutely fall in love with it because it's a really great place to be, seeing what some other options might be might cause you to ask more questions to the first place that you maybe thought was great, but then when you looked at another place, saw that maybe some things weren't included, or they didn't talk about something in particular that you're like, oh, I really liked that. Make sure you are getting all of your details, because while it is easier to move from one location to the other than it is moving in just completely from home, but it's still, there's a lot of questions and there's a lot of things to take into consideration. So I know I went through that oh so quickly. And it is a very, very big industry, very big decision for any family to be making. Sometimes you have all the time in the world to make that decision, and sometimes you're already sitting at the hospital bed having to make the decision in the next 24 hours because that's what your insurance said you have. And just knowing some of these things ahead of time can help the process seem a little bit easier. It can help you feel more confident in the decision that you're making if you've already had some of these conversations. And just know that we're all here to help. And even if you're looking for a loved one that is in Florida and you're like, well, this Shelby lady told me about all this stuff and now I don't know what to ask because I forgot. Just give me a call. I'm happy to help talk you through anything, or give you a tour of our campus just so you can see what senior living looks like. If you're like, that word meant nothing to me before she started talking, I'm more than happy to do all of that as well. Any questions? There's no way I explained it that well.
I did have one question. I wrote it in the chat too, but I wondered if you had any suggestions for local lawyers for the Medicaid process?
Yeah,
Or if it's
there
just
are
something
a
to
few.
Google?
I can send them to you. Yeah,
Oh, cool.
I
Okay.
have some cards that I can absolutely send to you. Yeah,
Okay, awesome. Thank you.
absolutely.
Shelby,
I-
just as a representative from the chamber staff who has visited your facility multiple times, I will vouch that chef is amazing. I have not had one thing from there. The food is incredible.
No, thank you.
Shelby, I was going to ask too. So, typically, whenever you have, adults checking in to the facility, um, how important would you say socialization is for that age? Like, there might be some that like to spend time alone. How do you navigate that and kind of dissect, okay, this is healthy for them to have alone time, but now this is too much alone time. How does that kind of come into play?
Absolutely. So socialization is huge, especially for seniors. Um, a lot of it is around just their cognitive abilities. So we've all heard that if you don't use it, you lose it. Well, if you're not having, active conversations on a daily basis where you're making your mind think or you're making all of these fine motor muscles move, they can tend to just give out on you. So keeping moving, exercising, keeping that social, it's huge. I don't have any statistics off the top of my head. The biggest one that I have is for Cambridge University actually did a study on older adults who dine alone versus those who dine with others. And the ones that dined alone, they tend to eat fewer fresh fruits and vegetables, and their cognitive abilities were a lot lower.
Hmm.
And if you're not eating the fresh fruits and vegetables, and when you're eating with others, it is easier. Going to the grocery store shopping for one is really complicated because they do all go bad so quickly. And, there's different factors that go into it, but it's also affecting you cognitively as well and physically because you're just not getting those nutrients. And while, yes, you can take a vitamin, it's not quite the same as consuming the, raw foods, fresh foods. And so it definitely has a huge, huge impact on you on a daily, monthly, yearly basis. And not saying, I mean, we encourage our residents to eat in the dining room, but it's okay if you're not feeling it today, because there's not all days when I want to talk to people either. And we don't want to take that away from our seniors. So we completely understand if your breakfast needs to be eaten alone every single morning with your cup of coffee to start your day fresh. And then you're finally ready to talk to people around lunch or dinner time. We understand that, but we do encourage our residents. They feel better, and you can see the changes in them on a daily basis from those who are just not wanting to leave their apartment. They're eating their meals alone versus the ones who are participating in the activities that we have. They are going down to listen to the entertainer at happy hour on Friday. They are sitting with new friends that they've made for lunch. And you can definitely see their changes just in their whole demeanor and their emotions on the ones that are participating with others versus keeping to themselves.
Love. And I also had a follow-up. Now that we're in kind of more of a technology-based world, is technology going to kind of make more of a presence in assisted living nursing homes?
Absolutely. So technology has already kind of taken into effect. So we have different types of call light systems. There's also different cameras that can be installed to detect falls. They can detect a lot of different things, and even technologies with things like thermometers. Like we can tell that you have a fever and that we need to make a change because your body is fighting an infection of some sort. We actually have the technology that it's been so well versed that as all of our Trilogy campuses, we have labs services inside our campuses. So we can actually pull blood work. We can do different types of lab work right here on campus. It doesn't have to get mailed out. We don't have to wait a week to get the results back. We can do all of that right here, which it's easier for the resident. They didn't have to get in a car. They didn't have to go sit in a cold waiting room. They didn't have to be around all those sick people who are also in the waiting room, and they get to stay, in their home. And within some are as quick as a couple of hours, we have the results back and we can make medication changes if we need to, or we can start doing something differently to help them feel better. So technology is huge. It's definitely making senior living and also living at home easier. So there are things like medication machines that will literally tell you, Jason, it's 9 a.m. You need to take this medication, and it will literally talk to you like it's a human and remind you that you need to do this. So it's never ending, really. And I'm always surprised when someone comes up to me and they're like, you'll never guess this new thing that I found. I'm like, I won't, because there's no way I would have even thought that that's possible. So technology has been absolutely amazing. Yeah. Thank you. Cindy?
Yes, hi Shelby. I'm trying to figure out where you're located. And I was thinking, are you new? Are you a new facility
We
near
are.
Kroger?
Yeah,
Were you
so
near
we're,
Kroger?
yes, right by Kroger. We're off Kyle
Okay, I
Station,
drive by
Kroger
that all the
94.
time. I should stop and look. We always
Yeah,
talk about
please.
that when we go by. And by the way, my son just graduated in marketing from Xavier, so go
Yay!
Musketeers.
I love it.
Yeah, we'll come visit sometime because
Yes,
we go
come
by there
see
all the
us.
time and always comment on it. You're next to that log cabin that's kind of over to the right,
Yes,
that
we
house.
are.
Yes, okay.
Yes. Any other questions? These are all great questions. Great participation.
Shelby, you also have some other options for respite care.
We do, yes. So yes, our campus is a full continuum. So we have independent living, assisted living memory care, and rehab and long-term care. And we can offer short-term or long-term stays. So if your family is planning a trip to see loved ones in another state or for a long period of time, and that's not exactly safe for your loved one to go with them, or you're the caregiver and you need a break, because we all need breaks. And that is not a bad thing. That is a good thing for everyone. We can offer that, and it's very easy. I can go through all those details with anyone who might be interested, but we can offer those short-term stays for assisted living, our memory care, and our health center. And breaks are super important. We have lots of different lunch and learns and things that talk about being a caregiver and caregiver burnout, because it is a thing. I know we're all working adults here. We're all part of the chamber. I'm sure we've all gotten to a point, even with our jobs, that technically only require us to be here from 9 to 5, but every now and again, it gets to be a little bit too much. And we take vacations. So, and that's okay as a caregiver to do that as well. Thank you.
I have a question about activities.
Yes.
I was at your facility the other day, and you had this amazing musician there. Can you talk a little bit about how the industry is kind of including more artists and employing more artists to entertain your residents? And I guess where would people find the talent for the residents?
Absolutely. I'm happy to share all of the talent that we have found in the Hamilton, Cincinnati area. We've gotten a lot. They're definitely changing. So the senior living of what our grandparents went to is nowhere close to what it is today. Like, no, not there's, day and night difference. So we incorporate more entertainers. We have artists that come in to do like painting parties. We have outings that we schedule with our residents. So we actually put them on our bus. We go out to lunch, we'll go out shopping. We've gone out to the Voices of America Park to go fishing. We are doing all of the things that they would have done in their home, and they would have done just, every summer we went and did this trip, and every Christmas we went out to Nashville, Indiana to go see this cute little town and market. We're incorporating all those things that they were doing 20, 30 years ago and making it a little easier. So we're continuing your life and making it just as exciting as it was before you moved in with us. And for some of our residents, it's now more exciting than when it was when they were alone, because they didn't want to drive that hour drive by themselves to go to a place that they didn't know if they could walk all the way from the end of the parking lot, when we get the, great service of dropping you at the door, and our driver will walk from the end of the parking lot. So the activities are amazing. And what they continue to come up with is also phenomenal. Since we have 4 other campuses down here in Cincinnati and 2 in Dayton, we get to borrow a lot of entertainment as well. So when we find a good one, we send it down and we're like, okay, here, book this guy. He's amazing. So that makes it really nice too, because we can give that same experience to all of our residents, even if they're not living in the same community. So yeah.
You're making me excited to sign up.
Right? You're like, count down the days till I'm 55. Let's
Yeah.
go. Yeah. Love it.
Does anyone else have any other questions? Shelby, when I spoke to you about doing a coffee conversation, you really put so much heart into this and so much time and thought, and really did a great job of covering each basis. And you have given us a lot this morning.
Thank you. Yes, it was a lot squeezed into 20 minutes, but I'm happy to talk further with anyone who might be going through this or are seeing it in the next 5 years, that it might be something you're going through. Be happy to help.
You like to share your contact information again, Shelby?
Oh, yeah, I sure can.
Just in case anybody has any questions, feel free to reach out to Shelby. She is amazing. She is super quick, so she's got her phone number and her email there. And she's with Liberty Station Health Campus. Beautiful new facility.
Thank you. Thank you all so much for your time this morning.
You're so welcome. So we're working on scheduling the date for the next coffee. So just keep an eye out for that. December is a little crazy. We've got some things going on, but we're excited to see you all. You can resource all of our coffee and conversations on our Facebook page at the Greater Hamilton Chamber. And they're also on our YouTube channel archived there. So you can always go back and resource information anytime. And if you have any questions, feel free to reach out to Shelby or anybody at the chamber. We're glad to chat with you.
Laura?
Yes, Jason?
I have the dates for the next coffee and conversation. They're going to be in January.
Okay, what's the date on that one?
It's going to be January 14th. It is with Pam Johnson. She is a certified appraiser and real estate specialist as well.
Awesome.
What's she going to be talking about, Jason?
I don't know yet, but keep an eye out on our calendar and we'll have all that information updated.
I think she's going to be talking about downsizing. So from that perspective,
okay.
So yeah,
Awesome.
which is kind of related to this, but it could be related to anybody who is, having a life change and needs to change their residence. So
absolutely. Well, this
We're
is
just
exciting
reorganizing your own home.
Yeah.
It's possible too.
Yeah.
Great
All right,
information,
everyone.
Shelby. Thank you.
Thank you, Shelby.
Thank you very much. We will see you all in January.
My pleasure. Have a happy Thanksgiving, everyone.
You too.
Thank you. Have a good